Well, there have been lots of inquiries and over the years and government policies which recognise that people with learning disabilities have poorer health and get worse health care than other people, and as a consequence that people die younger. And we know that. I did research 20 years ago and found that people with learning disabilities die 58 times. They're 58 times more likely to die before the age of 50 than other people. And the confidential inquiry, which was just reported this year, found that men die 13 years earlier than other men in society, and that women die 20 years younger. And the reason for this is because they're not getting as good treatment, they're not getting as many investigations, but there are also other reasons why people have worse health care, and they're to do with some of the other kind of social inequalities that exist in society, which can affect things like diet and exercise and the kind of accommodation people live in. And basically, I think the kind of general quality of people's life and well-being often affected by not having much choice or control over your own life. So I was talking about those kind of things in the session, but I also talked about how books beyond words are being used to try to empower people themselves in their communities, in their local communities. And currently what we're doing is setting up book clubs in libraries where people can come together and learn about different aspects of health and well-being through a very enjoyable medium, a story, a picture story designed for adults, where people can learn about, they can read a story which is about a real life issue which they might recognise for themselves or one of their friends or family, but which will have some kind of health and well-being messages in it. And through a discussion, people begin to kind of have a better understanding of how they can take more interest and control their own lives. So,
of course, empowerment's a very important thing. We need to do much more now to really make sure people with disabilities can speak up, and advocate for themselves.
I think speaking up, learning to speak up for yourself is absolutely critical, and there are so few opportunities for people to come together to talk about things, and so what the books are doing is acting as a prompt to discussion, so that people can then share their own experiences and encourage each other, so the peer support that comes through it is absolutely vital. And I think there's been a little bit of a tendency to think we have to wait for services to provide that support, and I don't agree with that. I've been a psychiatrist all my working life, but I actually think that specialist services should be services that are approached as and when they're needed, and that we should be doing far more to empower people in their local communities to understand their own kind of health needs. I've got a very good example of a colleague of ours, a woman with a learning disability, whose own cancer diagnosis was made because of her own speaking up after helping us to create the book Getting On With Cancer. And she used that book herself to go to her doctor and insist that she had investigations, and as a consequence she survived. And we've got lots of examples now of people who've been able to take a book along and say, I know about this, look, I've read this book, it doesn't have any words in it, it's got pictures in it, but through this story I have been able to understand something which affects me today, and I want you to take me seriously.